Just want to run through a basic IV assessment. So we start with the bag. Do we have the right solution in each bag? Is the solution expired? Is there any sediments or anything suspicious in the IV fluid? If that all looks good, continue on. Before I come in the room, I probably look at the MAR and hopefully I've already determined, are these two solutions compatible with each other? If not, we need to make some changes. Assuming that's all good, then we work our way down. We can start with the secondary line and we can see, is the drip chamber half full? Can we see the drips? Is it going at the right rate? If it is, follow it down. It's at the right port. No problem there. Then we can move up to the primary line. Same bag check as the secondary. Is it half full? I don't expect it to be dripping because the secondary is dripping right now. But once it does start to drip, I need to check that rate as well, make sure it's at the right rate. Follow my line down. I might be hooked up to an Alaris pump at this point. If I am, then I can check my rate that's set on the pump. In this case, I'm on gravity, so I just keep working my way down. Okay, I don't need, the clamps are fine. I'm not worried about them because I've already checked and I've seen them at IVs are running at the right rate. What I expect to see in terms of running IVs, I'm seeing, so the clamp must be fine. No air in the line, this is an important assessment. If we see air in the line, large amounts, we need to remove it. Okay, no kinks, it's not occluded, it's not going to block flow. Now I'm down and I'm looking at the site. Is it fastened well in terms of, is it taped down or is it pulling in a strange direction? Is the way the patient's arm laying, is it cutting off IV flow? You'd know that because the drip rate would be affected or the pump would be alarming, but you can check that. How you like the tape, does it look good? How does the dressing look? Is it dry and intact? We often ask if you have itchiness. I guess we're really looking for an allergic reaction. Is there a lot of redness? Is there a reaction to the tape? I mean, a small amount of itchiness under a dressing, probably not going to do a lot about that, just to be clear. But if it looks like it's having an allergic reaction, that's a different story. We need to look into getting some different covering, different kind of tape to use for this. Then we're checking for things like, is there leakage? Does it look like there's leaking out of the IV site? On the other hand, is there leakage into the tissues? Do we have infiltration? Do we have coolness? Do we have swelling? Do we have redness like phlebitis? Is there pain? Do we have signs of infection like redness, like discharge, like pain? If all those look pretty good, the site looks good, then that pretty much well completes our system. Of course, there is a bigger picture, and that is, are they suffering fluid overload? How do their lungs sound, and how does their edema look? But that's a different video. That really just completes our immediate IV assessment.